Hello, I'm Dr.Park, prosthetic urologist practicing in Seoul, South Korea. Recently, I was invited to AUA to give a talk in the SMSNA session. They asked me about what happened with the cosmetic phalloplasty in South Korea, because they are experiencing that cosmetic phalloplasty issue in US as well. It is kind of booming up, and they do not know how to deal with it. It's not really about the scientific surgical technique nor my experience with this surgery or that, but it's more like asking for me, how would I have done it, or what happened as a history. So someone needs to tell them what happened in ahead of the time, so that they will not make same mistakes again. I just told them my thoughts about the what happened with the cosmetic phalloplasty, because in my eyes, urologists really haven't done aesthetic medicine. We are really not exposed to aesthetic medicine at all. Throughout our training, throughout our practices, we really don't do nothing with the aesthetics, right? We don't do, the skincare or the other cosmetic surgeries, not really. Probably circumcision is the most closest thing, but the circumcision is not really an aesthetic surgery. In some cases, it's a functional surgery. I'll put it this way, we haven't really know what the aesthetic medicine is. That is the reason why we are having trouble how to managing this issue. So my suggestion was that let's learn from the others, which is the plastic surgeons and the dermatologists. They had to deal with the aesthetic medicine, and let's see how they are cope with them. It's not really helpful to branding them as a bad thing or something. No, it's a basic human need. As long as there is a demand, there will be a supply. Our role is to understand how we can be a good supplier rather than judging the patient's desire. So this is my talk. This was my talk. Hopefully this could, help them to navigate that issue better. It's just an interesting, trend in the worldwide. Men are also interested in the aesthetic medicine as well. Usually, women are the major customers with aesthetics, but I guess in the coming days, men will be the same customers for the aesthetics. So either way, we should be able to prepare that issue with the help of our colleagues in other specialties. It was great to attend the AUA meeting, and hopefully I could see my friends again, and probably next sexual medicine meeting, hopefully I'll discuss more about the penile implants as well.